I want to bring in Dr. Leo Nisola. He's an immunotherapy scientist and advisor for COVID Act Now. Dr. Nisola, welcome. Great to have you with us. So how quickly can the Pfizer vaccine make a real impact on the state of the pandemic in the U.S.? And what will be the effect of this first round of vaccinations?
Thank you for having me, Tanya. This is a very special day. I think we will never forget this day until many, many years from now. What we saw today and in the past few weeks with the drug approvals and seeing healthcare workers getting the first doses of the vaccine in the United States today was a very emotional moment. There's, of course, a huge challenge into delivering those vaccines across the country in places that are hit by food deserts and places that do not have the personnel and the complexity that it requires to deliver those vaccines. But still, we now, during 2020, we have a safe and effective vaccine. And we just learned recently that Pfizer's vaccine actually confers a robust protection into the immune system with the first dose. So that will help us not overload the hospitals that are now seeing their ICU beds completely full. In California, San Bernardino County and other counties around the LA area are at capacity. So this is a huge progress, and it will help us to relieve the burden on those hospitals too.
Absolutely. And the U.S. reported more than 109,000 coronavirus hospitalizations Sunday. What is the vaccination effort going to look like inside the hospitals that are already overwhelmed with patients? Do they have the capacity to have this vaccination system in place at the same time that they're caring so desperately for all of these patients?
So the federal administration has advised states to take the matters into their own hands. So we would expect that states will react and will have the guidelines differently as to who will get it first. I assume that some hospitals will prioritize workers that are in the front lines. They are the receptionists in those hospitals and emergency rooms, but also folks that are working with those severe patients in the ICUs as well. So what I expect is that states will reach out to experts in those logistics to make sure that folks at home feel confident with the vaccine, but also that the vaccine gets delivered to those who are more prone to severe illness.
And Dr. Nisola, you mentioned earlier that the first dose is giving some kind of robust protection. I want to ask you a little bit more about that, because our understanding is that everybody who receives the Pfizer vaccine needs to get a second dose 21 days later. How much protection does that first dose actually give?
So we don't have the exact numbers yet, but we were seeing in what we saw from Pfizer's presentation during the FDA hearing for the approval of the emergency use is that this vaccine provides a robust immune effect that we yet cannot qualify. So we don't have those exact numbers. But what we are seeing from the patients that have received this vaccine during the clinical trials is that the immune system is reacting with an immune response that will be enough to give for at least a month or two after the first dose. So the judge is still out, but this robust immune response after the first dose was something that we were not expecting. So it is good news.
And then once you've had that second dose and the immune response is at its highest level, how long does that last?
Well, we still don't know, and we are looking forward to seeing the results of other clinical studies that is testing this vaccine in other groups like children and young adults. But what we are expecting is that this vaccine eventually will become a yearly vaccine, just like the flu vaccine.
All right, so what has the U.S. learned from the Pfizer vaccinations that are happening in the U.K., which started last week? Obviously, it's not a lot of time and a lot of data to go on, but is there anything we can glean from what's been going on in the U.K.?
Yeah, I think number one, the UK has a mass vaccination campaign going on throughout the year. And I think the United States needs one too. When we found out that we needed a vaccine to get out of this crisis back in March, we should have had a robust vaccination plan in place, and we still don't have that yet. So I'm looking forward to seeing officials going online and advocating for people to feel comfortable with this vaccine and get vaccinated on camera, like Dr. Fauci had said he would do, and President Barack Obama as well. So I will jump on my Instagram and get vaccinated on camera when it's time for me to do so. And I would encourage everyone at home to do the same.
All right. Well, Dr. Leo Nisola, thank you so much for joining us on this exciting day. We appreciate it.
Thank you so much.